everyone. Thank you so much for joining us. This is Inga Hansen, editor of MedEsthetics magazine, and we are going to go ahead and get started. If you have any questions during the webinar, please type them into the box on the right-hand side of your screen, and we will be answering them at the end of the presentation. Today, we'll be discussing Zoe, a proprietary autologous platelet-rich plasma-based skincare product. Dr. Zoe Draelos will be presenting scientific data from clinical testing, including both 60 and 100-day split-face randomized blinded studies. Dr. Draelos is a research and clinical board-certified dermatologist and a fellow of the American Academy of Dermatology. She's in solo private practice in High Point, North Carolina, and a consulting professor of dermatology at Duke University. At the end of the presentation, she'll be joined by Marianne Guerra, president of Aesthetics Biomedical. Thank you so much for joining us, Dr. Draelos.
Thank you for having me. Well, I'm very excited to have this opportunity to share with you some of my research. I definitely think that platelet-rich plasma is an area of promise in dermatology. It's been used for quite some time in other areas of medicine. It's been used for promoting the healing of bone grafts in oral surgery. It's been used to promote healing in orthopedic surgery indications. And now we're seeing its use in dermatology. Perhaps its first use was for the treatment of androgenic alopecia, and now we're seeing it introduced topically for cosmeceutical use in dermatology. And next slide. So my background is indeed that I am a research and clinical dermatologist, and I enjoy working on many different types of projects, both in the pharmaceutical realm as well as the over-the-counter realm. Next slide. So what exactly are platelets and what exactly is platelet-rich plasma? Where the normal platelet count in human blood is somewhere between 150 to 350,000 platelets per microliter. Platelet-rich plasma, abbreviated PRP, is just what it sounds like. There are more platelets in the plasma than in normal human blood, and indeed the platelets have been compressed or concentrated. So platelet-rich plasma is defined as 1 million platelets per microliter in a small volume of plasma with a full complement of clotting factors. Now within platelet-rich plasma, there are a number of growth factors. The 7 major growth factors that are present are platelet-derived growth factors, AA, BB, and AB, transforming growth factors, also known as TGF, B1, and B2, vascular endothelial growth factor, known as VEGF, and endothelial or epithelial growth factor, known as EGF. These growth factors are substances that can promote the growth of skin, and they've also been used to promote the growth of follicular structures via injection into the scalp. There are many other growth factors besides these that are found in platelet-rich plasma, but these are the main ones. What's really interesting is that for years we've been using growth factors in cosmeceuticals. Some of the earliest cosmeceuticals used growth factors derived from apple stem cells or pulp mulberry stem cells. We then started introducing growth factors into cosmeceuticals that were derived from neonatal foreskins, fibroblasts that have been cultured in a petri dish that were derived from neonates, and these growth factors were then put into cosmeceuticals. But this is the first time where we've really looked at utilizing platelet-rich plasma of the individual who donates the plasma and then giving it back to them in topical form. So this approach to platelet-rich plasma is really the first personalized cosmetic that is available for use in the modern era. Now, these growth factors are found within a normal clot in addition to fibrin and fibronectin. These are some of the adhesion molecules that are necessary for cell migration. They're also found in wound healing, and for that reason are thought to be able to make younger skin have qualities of positive wound healing that then can be transferred to older skin, where you can enhance positive wound healing through the use of topical platelet-rich plasma. So let's move to our next slide and talk a little bit about how platelet-rich plasma is prepared. Because the preparation of the plasma is so important, because this determines the activity of the plasma and ultimately its clinical results. So in order to prepare platelet-rich plasma, you first have to draw blood from the patient. you have to add an anticoagulant known as sodium citrate. Otherwise, the blood will clot in the tube and you won't be able to centrifuge it properly. Now, there are two different ways of preparing PRP. One is to use a 60 milliliter blood draw from the patient, but a newer method is actually to use a 20 milliliter blood draw. Both of them have been shown to be equivalent in terms of histologic benefit and investigator-assessed efficacy, and we'll come back to this point a little bit later. In order to prepare PRP, 2 spins are required. The first spin is known as the hard spin, and this spin is to remove all the red blood cells. You do not want to have any red blood cells in your platelet-rich plasma because the red blood cells activate the platelets, causing them to release in bulk all of the growth factors that we discussed. So it's very important that your platelet-rich plasma contain only platelets. So the first spin, you put the blood in the centrifuge, you do the hard spin, and you separate the red blood cells from the plasma containing the platelets, the white blood cells, and the clotting factors. 3 layers result from the hard spin. The upper layer, after centrifuging, contains the platelets and the white blood cells. The middle layer, known as the buffy coat, contains white blood cells, and the bottom layer, which you want to remove and discard, contains the red blood cells. Next slide. Platelet-rich plasma thus has a yellowish, translucent appearance to it, as shown here. After the first spin, the platelet-rich plasma is then put through a second spin known as the soft spin. This spin separates the platelet-rich plasma, where the platelets are concentrated in the bottom of the tube, from the platelet-poor plasma, abbreviated PPP, in the top of the tube by removing more red blood cells. I cannot emphasize that proper preparation and centrifuge technique is critical to obtaining high-quality active PRP. If you do a review of the literature, you will note that there are many individuals and studies that have been published showing that PRP does not work. Some of the literature that points to inactivity of PRP may be due to poor preparation of the PRP itself. When PRP was first introduced, some early laboratories used a standard hematology centrifuge to prepare the PRP. Standard laboratory centrifuges do not spin at high enough RPMs to properly separate out the PRP, and for this reason probably had red blood cell contaminated PRP or improperly concentrated platelets in their PRP, and thus the product was found to be inactive. In order to truly prepare PRP, specialized FDA-cleared equipment with a validated centrifuging double centrifuge spin process is required for activity. Next slide. So how exactly does PRP work? Well, platelet-rich plasma works through degranulation of the alpha granules that are in the platelets, and it is these alpha granules that contain the growth factors. The biologically active growth factors are actually preserved within the platelets, and as degranulation occurs, the alpha granules slowly over time release the growth factors. It is very important that premature degranulation does not occur, otherwise all of the growth factors are released at once, which is not desirable. Once the platelet is activated, the granules can then fuse to the cell membrane, releasing the growth factors. Next slide. Once the degranulation process occurs, the granules bind to the transmembrane receptors of the target cells, such as mesenchymal stem cells, fibroblasts, endothelial cells, and epidermal cells, all of which are found in the skin. Once this binding occurs, it activates the intracellular signal proteins, and these express a gene sequence that directs cellular proliferation, collagen synthesis, extracellular matrix formation, and numerous other pathways that promote healing and reparative processes. It is also through this type of release that we see an improvement in aged skin, allowing it to heal and repair more readily, which possibly might be the explanation for the reason why topical PRP works. If the platelets are somehow damaged, they're incapable of inducing this response, and the PRP does not work. So you can see preservation of the preparation is so important, and the prevention of degranulation is key. Next slide. So this method takes platelet-rich plasma and puts it into a vehicle. The vehicle is a moisturizing vehicle, and it also contains a variety of very important substances. The first is a blend of electrolytes known as Biolyte 5 that supports the platelet viability, because within this personalized moisturizer, you have to have something that will allow the platelets to remain viable. The second thing that you need is you need to be sure that there is no growth of viruses or other contaminants. But yet the preservative system that you have within the vehicle has to not kill the platelets, but has to be toxic to viruses, candidal organisms, and bacteria. So the unique vehicle is key in activating the platelet-rich plasma, preserving its sterility, and allowing it to be a nice, elegant cosmetic base. Next slide. In order to determine how active the vehicle was in preserving the product, and also determine how effective the platelet-rich plasma in this vehicle was in improving skin, we did 2 clinical studies. One ran for 60 days, and our second study ran for 120 days. The purpose of these 2 clinical studies was not only to look at how the product performed in terms of efficacy, but also to look at stability. And that's the reason why the first study was done for 60 days and the second study was done for 120 days. 20 patients were enrolled in the study. No tolerability issues were noted and no adverse events occurred. I evaluated a variety of cosmetic clinical attributes to include skin softness, firmness, luminosity, radiance, and hyperpigmentation. The subjects were evaluated at 4 weeks and 8 weeks, and the subjects provided an assessment evaluation, and I assessed and evaluated as well. 98% of the patients were satisfied with the vehicle and its performance on their skin, and actually further studies have been done to demonstrate that the vehicle that comprises the PRP formulation has a 2-year shelf life. Next slide. These are the results of the 8-week and 16-week studies. Now, in order to determine that the PRP was really the active here, we designed a split-phase study. Some of the subjects used the platelet-rich plasma plus the vehicle on the right phase, and some used the platelet-rich plasma plus the vehicle on the left phase. And then on the opposite randomized side, people used just the base serum. So the investigator was blinded as to which side the products were being applied, and the subjects also did not know which side of the face received which product. 20 males and females aged 30 to 60 years of age with a 3 to 6 wrinkle score on the Griffith scale were evaluated. Subjects were seen at baseline, at week 8, and at week 16, and they were given a left or right face bottle that contained the base serum, with the opposite side receiving the base serum plus the platelet-rich plasma, and all subjects were dispensed a sunscreen with SPF 30. Here in the bar graph, you see percentage change in terms of dryness, luminosity, radiance, firmness, texture, line, and tone. A taller bar is indicative of a greater percent change, and you can see that in all attributes, there was cumulative improvement that continued into week 16. The dryness and luminosity were perhaps some of the most interesting improvements that we saw. But further on in the 16-week study, you can see facial lines and tone improved over the 8 weeks. Clearly, these are attributes that require a longer period of application in order to see benefit. But as a cosmeceutical, the profile for performance was quite good. Next slide. Now, this slide looks at the autologous platelet-rich plasma at baseline as compared to week 16. Remember that a lower score basically was a better score. And you can see that in all the attributes, dryness, softness, radiance, firmness, texture, and lines, that there was improvement from baseline to week 16, as indicated by a lower score and a decreased bar in pink representing week 16. One of the interesting things about this particular study is that this is the first true personalized cosmetic. And I know we've talked about for many years in dermatology developing cosmetics that work with the patient's own body, whatever that means. But here we're actually taking the platelets from the patient and putting it in a product that's uniquely developed and uniquely suited for their skin. Next slide. Now, we also did biopsies and selected patients. The patients were selected randomly. And these are some of the histologic results that we received that I'd like to review next. The first is the Reedy-Peg analysis. Over time, the Reedy-Peg actually flattens, which is the junction between the epidermis and the dermis. It is this flattening of the Reedy-Peg that actually allows skin tears to occur in the elderly, as well as senile purpura. Because the more undulations you have of the Reedy-Peg, the greater adherence there is between the epidermis and the dermis. Aged skin is characterized by a very flat Reedy-Peg architecture as seen in the upper control histologic panel here. In the lower histologic panel, we see treatment, and you can see in this particular series, comparing the control in the above to the treatment picture down below, you can see undulation and more architecture in the Reedy-Peg. This indicates that the skin now has better stress and strain capabilities, is better able to withstand friction, and the skin is considered to be younger and more healthier looking. So these were some of the changes that were indeed seen with the study. We also evaluated, and we'll go on to the next slide, and take a look at collagen type 1. Same thing, you see in the upper panel the control from baseline, and then you see the treatment. So what do we see here? Well, these are computer-enhanced images where the collagen 1 is basically been color-coded. So yellow means it's weakly positive for collagen type 1. Orange means it's positive. Red means it was highly positive for collagen type 1. And blue means negative. So if you compare the control to the treatment area here, what you see basically is more red. And that red indicates high positivity, which is seen in greater concentration in the treatment specimen than the baseline control specimen. And you can see more expression of collagen type 1. So not only do we have improvement of Reedy-Peg architecture, but we also have improvement in collagen type 1 production. Next slide. So in the elastin, we also were able to show improvement as well. So we had increased expression of collagen type 1, elastin, and improved Reedy-Peg architecture. So what exactly is the mechanism of platelet-rich plasma activation? And this cartoon nicely sums it up here. So we basically take 20 mils of the subject's blood, we centrifuge that blood, we take the platelets and concentrate them in serum. Then the platelet has to release its granules. So over the left-hand side, we see the stable platelet, we see the granules, we have something that activates that platelet, the granules basically fuse and release the substances involved in angiogenesis, coagulation, cellular communication, and inflammation. These are basically biomolecules, and these biomolecules can then be put into a vehicle in order to deliver these positive attributes directly to the skin. Next slide. Now, as I mentioned earlier, there were 7 most important substances present in platelet-rich plasma, but actually within a platelet, there are hundreds of different biomolecules, and they're all listed here. The platelet is a highly biologically active substance, and that's why platelet-rich plasma provides many, many benefits through autologous growth factors that can be applied to the skin. Next slide. Now, one of the things that's very important is to demonstrate that all the platelets do not become activated all at once in the vehicle, because you want to be able to use the product over a period of time and continue to have the factors that we just evaluated released. So in the top image, what you see there are inactive platelets, individual platelets, that have been evaluated by 100 times magnification using scanning electron microscopy. Now, in the lower frame, what you see is the platelets clumping together, and this is what happens when the platelets aggregate and release the growth factors onto the skin surface. So what needs to happen is over time, the platelets start to release their payload of growth factors. And that's how, over time, in the presence of an activator, you can slowly release these growth factors into the skin. So this allows a topical preparation to have an activator within it that supports preservation of the formulation, but also over time activates the platelets so they can release their payload onto the skin. Next slide. One of the concerns, of course, whenever you use a biologic substance is its ability to remain sterile. And of course, it's also important to be sure that you can't pass on hepatitis B or HIV, two very important infections. So a study was done basically to understand the virucidal abilities of the vehicle into which the PRP is placed. In these studies, if you look at the very, very far right-hand side, you'll see percent reduction. And you'll notice for hepatitis B, there's 98% reduction in the virus. And then if you look at HIV-1, you'll see again the same percent reduction. So the vehicle preserves the product. It prevents fungal growth, bacterial growth, and viral growth. It also preserves the stability of the platelet, but it also allows the platelet to activate and release growth factors into the skin. So the vehicle is critical to delivering the PRP over time in a cosmeceutical preparation that's active and safe for the patient to use. Next slide. So what I basically demonstrated for you is clinical, histologic, and molecular endpoints. Most of the patients felt that the product was quite elegant and easy to use, and was not accompanied by some of the issues that accompany either microneedling or injection of the PRP, because the product could be applied in the privacy of their own bathroom over a period of time. Next slide. The vehicle actually was specially developed so it can be used by all skin types, so that includes oily, normal, combination, and sensitive skin. It is makeup compatible. You can put a thin layer on, then you put your daily makeup on, and any sunscreen you wish can be used on top of that. We did not see any incidence of irritant or allergic contact dermatitis in the study, and this particular product could be used with other moisturizers if the patient desires. Next slide. So I'd like to show you a few representative before and afters. This is a younger patient. She has rosacea tendencies. She is a Fitzpatrick type 1. And you can see before and after treatment, you can see that we have improvement of overall facial erythema and an overall improvement in facial brightening from the before image on the left to the 8 weeks post-treatment image on the right. Next slide. This is an example of a male patient who underwent 16 weeks of treatment. And what you can see is in the before and the after image, you can't point to really any one quality, but he has more radiance and a better facial glow in the after image as compared to the before image. Next slide. This also is a gentleman who was entered into the study. He underwent 12 weeks of treatment. He was in that particular study. And you can see from the before to the after image that same improvement in overall skin brightening. But you also can see a reduction in forehead wrinkles as well. Sometimes forehead wrinkling can be hard to assess, but you can see that he's very much in the same position and the same repose in terms of expression on the face in the before and 12-week picture, demonstrating nice smoothing of the skin and some reduction in fine lines. Next slide. This is another lady. She's a Fitzpatrick type 2. She's an older woman in her late 50s. And you can see from the before picture to the after picture, you can see again improvement in overall facial brightening, as well as improvement in skin tone and some softening of some of the fine lines, especially around the eye area. Next slide. The results of our study were published in the Journal of Cosmetic Dermatology. This particular work was done with the 60 ml blood draw. But we now know through a second study that will be published shortly that you only need to draw 20 mils of blood from the subject, which is nice. It's a much easier blood draw. It's a shorter blood draw. There's a smaller volume of material that's removed. But when you do a 20 mil blood draw, you actually get equivalent histology and efficacy to the 60 mil blood draw that was published in this particular article in the Journal of Cosmetic Dermatology, published in 2019. So it's interesting to finally see personalized cosmetics become a reality. And it is interesting that platelet-rich plasma can be used topically for anti-aging purposes. Next slide. And with that, what I'm going to do is pass the baton back to our moderator.
Thank you so much, Dr. Draelos. And we actually have some questions that have come in. And the first one was asking about, if you have older patients, does the quality of the PRP and the results you can expect degrade with age?
No. Their platelets will release just like younger platelets will release. Of course, if you're older, you may have more cosmetic challenges that need to be overcome. But platelet-rich plasma really can be used in individuals of any age with efficacy and safety.
And in terms of the first spin, the hard spin, the soft spin, how long is each spin in the centrifuge?
That can be a little bit centrifuge dependent, but the first soft spin is usually somewhere around 2 minutes. Now, it does take time for the centrifuge to get up to speed, and then, of course, to slow down such that the lid can be opened. So a 2-minute hard spin takes about 5 or so minutes from start to finish. And then the second spin is the longer spin, and that typically runs around 6 minutes.
And is it safe to microneedle this product into patients after application?
Yes, it can be used for microneedling. You can use it one of two ways. You can either put the product on first and then microneedle over it, or you can microneedle the face first and then put the product on. Now, I have to say that that's anecdotal because we have not done a study combining this technology with microneedling. But PRP has been used for microneedling, and there have been published studies describing the use of PRP in conjunction with microneedling. That can either be manual microneedling or manual microneedling where the microneedling device is also electrified.
Mm. And has this ever been tested for hair regrowth or restoration?
I know the only work that I'm aware of that's been done to date with this preparation was a topical facial application. It's a good thought. You know, the hair follicle is at the junction of the dermis and the subcutis, so you'd have to get pretty good penetration to actually have it be efficacious. And I think that's one of the reasons why people are doing more injections for the treatment of anergetic alopecia as opposed to, for example, putting a PRP on the scalp and then doing microneedling, because the site of activity is so much deeper in the skin.
And there's also a question about the pricing for the base. And I was wondering, one, what typically is the retail cost, and does that include the in-office visit to prepare the PRP?
You know, I think that I would like to let the sponsor and the company answer that question. I would not be the best source of information for that.
Okay, and you mentioned the importance of using an FDA-approved PRP centrifuge. Do you have any recommendations? Are there certain ones that are especially designed for PRP that you would typically work with?
There are, and I think I'm going to let the sponsor talk about that as well, because they do have certain centrifuges that they feel are superior to others. And I will let our next speaker address that question also.
And does this...
do you want me to address it right now?
Sure. This is Marianne, president of Aesthetic Biomedical.
So we, when we started this, and the first study was done with the M-site centrifuge. and that's where we use the 60 ml kit, and that had the double spin. The second study was done again with M-Site, and we did the 20 ml kit. M-Site has a 20 ml and a 30 ml and a 60 ml all available, and we offer all of those in a package for SoMe. If you use the 20 ml, it's a single spin, and it is a 60-second spin with the additional time that Dr. Draelos mentioned in terms of getting up to speed and then slowing down to speed. But it is pretty quick and delivers an incredible quality product. And so ABM, Aesthetics Biomedical, offers the kits and offers the SoMe deals and everything with the M-Site centrifuge. We have had others use it with Eclipse and with Region Labs. We do not provide those disposable kits, but we will sell SoMe as a product without them. If you look at the pricing that was asked, I'll just address that right now. If you did the 60 ml kit, it's a per patient kit, and the 60 ml, again, this is the M-Site kit per patient, would include the kit. It would include the 3-month supply of, that's basically 3 vials of the SoMe base, and a small refrigerator. We did not talk about the refrigerator, but this product is refrigerated, and when you apply, you take it out of the mini refrigerator, the cosmetic refrigerator that sits hopefully on your countertop in your bathroom. The change in temperature as you put it on your face helps to activate those platelets that Dr. Draelos mentioned. So that kit for the 60 ml, including the patient and the refrigerator, is $695. If you get the 30 ml kit, 3-month supply per patient, and the refrigerator, it's $595. And if you get the 20 ml, it's $495. And if you're using somebody else's centrifuge, the Eclipse, it would be $395, and that would then only include the SoMe 3-month base, and it would include the mini refrigerator for the patient.
Great, thank you so much, Marianne. And another question for Dr. Draelos was, are you using anything to activate the platelets before you create the product?
No, you put them in the product itself, and then when it's applied to the face and comes out of the refrigerator, then the platelets activate. And that's one of the reasons why the product has to be refrigerated.
And do you ever use this or believe it's helpful as a post-procedure product, like post-ablative laser? Does it improve healing or wound healing?
Yes, I do use it that way. I don't have any data to share with you to support that, but yes, it seems like that would be a natural segue because the platelets are very rich in factors that are necessary to heal skin, and a lot of platelet-rich plasma is being used in athletes after injury. For example, if they have a tendon tear or a muscle tear, it's interesting how many of the sports therapists are starting to inject platelet-rich plasma into very accomplished athletes to speed healing of injuries that occur during sports events.
And has this ever been studied alongside other growth factor containing topicals to look at the benefits of using the autologous versus other types of growth factor?
I think these are all excellent studies that people are suggesting, but I'm not aware that that's been done either. But in terms of from a physiologic standpoint, it just seems to stand to reason that you would get better results using your own growth factors than using growth factors that came from a non-autologous source. So, autologous source should provide basically what you're doing is you're repositioning the growth factors from your bloodstream onto your skin. And it would seem that that would provide a more physiologic way to induce skin repair and a more youthful behavior of aging skin processes.
And we have time for one more question. If we don't get to anyone's questions right now, we will follow up, but we're going to do one more question and then move on to the second part of the presentation. But 1% question, just is this like a daily moisturizer or is this more of a treatment serum?
Well, the base that's put in is somewhat moisturizing, but if you have extremely dry skin, you may wish to use this product as a treatment serum and then use a moisturizer of your choice on top. For people that don't have really dry skin, the serum might be enough moisturizer. Perhaps in the summertime it would be sufficient, but maybe something else would need to be added in the winter. So this can be looked as a treatment moisturizer that can be accompanied by other skincare products as necessary. So really the dermatologist or the plastic surgeon or the esthetician can use this product and then incorporate it into other skincare routines if they wish.
Great, thank you so much. And now I want to introduce Marianne Guerra, who came and answered a couple questions briefly. She's the president and CEO of Aesthetics Biomedical, and she wanted to talk a little bit more about SoMe and also what they're planning in terms of their marketing and improvements going forward. So welcome, Marianne.
I really am pleased to be here today and so excited that all of you joined us. I know these are tough times for all of us with COVID, and we're trying to make the most of everyone's time by providing you with good educational information. And Dr. Draelos did an amazing job providing the information that she did here. My background was, before I started the company, I spent quite a few years at the National Institutes of Health, and one of the individuals that I worked very closely with, he was one of my lab chiefs, and my director was Dr. Anthony Fauci. So in these days, you know, seeing Tony online and dealing and fighting with the big battles that we're facing with COVID, you know, at least I feel really comfortable that we're in great hands. So, and good luck to all of you, and be safe out there. But know that Tony's an amazing guy, and I'm glad he's in charge of what's happening there. So Aesthetics Biomedical was formed in 2016, and the whole idea was to try to really bring quality products to the market backed by the strong science that I think you heard today from Dr. Draelos. We also really care about the patient experience. So one of the things we learned that it's not just about having a device that works or having a product that works. I mean, you want a product that the patient likes, that the physician likes, that delivers outcome. And it's just, you know, from soup to nuts, from the time they walk into the office to when they go home, they experience something positive that makes them want to come back to the office. So that's one of the fundamental principles of the company. The company launched with the Vivace and the Vivace experience, and in that we learned the whole experience feature, and we also have a product called the Senza, which is a laser hair removal. So one of the things that I think is really important is to not only have quality products that deliver great outcomes that are documented, but you also want to have a good return on your investment. I mean, all of these things are really important to a practice. And so when we look at our products, we look at all of that. For example, SoMe, one of the things that's wonderful about SoMe from a physician perspective is it's only available through a physician's office. So they're not going to be able to go on Amazon, although, you know, we all love Amazon these days, but they're not going to be able to go on Amazon and buy this. They're going to have to go into the office and come back and see you. And we think that that's really important, and we think that that helps deliver a great ROI for the office. But the other part of it that we realize, and you just can't ignore, is you have to have good marketing as well. And so, you know, the consumer has to love the product, the physician has to love the product, and it all has to be wrapped into quality product, good marketing, and great ROI. So we were excited. Just on Tuesday, it was announced that SoMe won the New Beauty 2020 award for Best Innovation. So if you know of the New Beauty Awards, they tested 9,000 products and treatments. 208 were selected to be in the magazine under different categories, face, moisturizer, etc. But only 9 were selected to be in the Best Innovation category. And SoMe was one of 9, along with Janu, which you probably heard of, in that innovation. And the thing that they said, which we really loved, was new is good, but effective is better. And I think what you've heard from Dr. Draelos is this is absolutely new. It's not available anywhere else. It's patent pending. We just got a patent issued about a month ago on this, but it works, and the patients like it. So we're really excited about that. The other thing with SoMe that Dr. Draelos alluded to is that we call it SoMe 1, 2, 3. We're not advocating a lot of different products with it. Wash your face, use SoMe, and put a moisturizer on if you need a moisturizer. We have seen individuals stop using their retinol, not using vitamin C and other products because they're so rejuvenated with the use of SoMe. So that is something that is another outcome, a positive outcome, is it simplifies the whole skincare regime. And for some, and many of the dermatologists and physicians we've talked to, they like that because it just simplifies the number of SKUs in their office. It simplifies, any unintended results from using cosmetics. So let's talk about the marketing. Molly Sims was announced as our brand ambassador recently. Molly has done an amazing job getting out there in terms of being able to get right to the consumers, but also physicians. She has drawn additionally all different types of media for us, both the consumer and industry. And when we combine, the great science with this great marketing for the physician, we think that this all wrapped into one is really a good opportunity for the physicians. Molly, she was in the Aesthetics Guide this month. Just go to your Aesthetics Guide or pull it up online and you'll see that. And this is the video that Molly's done to promote it. And it really does touch upon what a great advocate she is and brand ambassador for the product if you have it in your practice. Go ahead. Why don't you play the video?
If you follow me, you know how much I love beauty, health, wellness, and fitness. When I was younger, my mama always taught me to preserve, and now I have found the secret to youthful skin with SoMe plus PRP. It keeps my skin looking so fresh and radiant. It even helps to reduce appearance of unwanted puffiness and darkness around the eyes. My dermatologist first introduced me to PRP years ago, and now I'm finally able to harness the benefits of PRP that I've come to know and love to improve my own daily skincare routine with SoMe. I love SoMe plus PRP, and together it is what makes SoMe so personalized. Your own PRP may be added to the specifically formulated SoMe serum by your medical physician to help improve signs of aging. Less is more, and I truly believe that if you can replace one part of your skincare routine and make it natural, you should. SoMe plus PRP uses your own body's regenerative properties to stimulate natural collagen and elastin for visibly renewed firmness, luminosity, and damage from the sun. SoMe revitalizes and rejuvenates for glowing, healthier-looking skin. This cosmetic serum targets signs of facial aging, including fine lines, dryness, and discoloration. My personalized skincare, it's SoMe.
I wanted to let you know all of the presentation, the science, the article that Dr. Draelos mentioned. All this is available digitally to you. You can go to the Aesthetics Biomedical website and request all of this, the papers, the science behind it. We want to make sure that you have that available to you. So just go to our website. And if you have any questions for me right now, happy to answer anything.
Thank you so much, Marianne. And one question that came in is someone was asking, is there an AM and PM product, or is it one individual product that can be used for both post and daily use?
Thank you. It's just a single product. So you're using the same serum both morning and night, which simplifies it, and it is for the neck and the décolleté if you want to do that as well. We have had, just to answer some other questions that came up, physicians using it post-treatment in terms of both microneedling, other laser treatments that they've done. We've also had it used with a plasma pen in terms of a speedier recovery. So we are seeing that while we thought it was a day and night daily routine, we are seeing that the product is being used in combination with other treatments.
Great, and we had a question about whether people would get a copy of the webinar, could review it. So wanted to let everyone know this will be up on medestheticsmag.com/webinar by tomorrow if you want to share it or review it. And also, as Marianne mentioned, they will be following up with you also so you can have access to any information that was shared here. And we have a few more questions coming in. And now somebody just wanted to clarify that this does need to be refrigerated to last for the 3 months.
Right. So interesting. So let me explain that to you. Is that the base itself doesn't require refrigeration, and actually the base plus the PRP wouldn't require refrigeration for the 3 months. It's been tested, it's stable. What we have learned is when you put it into the refrigerator, you're changing the temperature. And when you take it out of the refrigerator and you use the mechanical movement of rubbing it in your hands and then putting it on your face, both the mechanical movement of putting it on your hands and then the temperature change is what activates the platelets. So the refrigeration is recommended and the refrigerator is provided so that you can have this change in temperature that activates those platelets. So what we did is the base serum that was designed by our scientists is great. It keeps everything stable. The next secret sauce was, well, then now that it's stable, how do you activate it? And so that's part of the activation process.
And in terms of how the process works for the physician, they prepare the PRP. Are they responsible then for mixing it with the base in office, or how does that process work?
Yes, so they are responsible in the office. They would draw the blood, they would spin it down, and literally it's just like taking your the PRP. If you would come up with about 9 mLs of PRP. You open the 3 bottles. You have it open. You put 3 mLs in each of the bottles. You shut it. You give a light shake to it, and we will train you on all of that. And then you just put it in boxes and send it home with the patient along with their refrigerator. And it stays stable. You know, they don't have to refrigerate it on their way home, but once it's refrigerated, it should stay refrigerated.
Great. Well, thank you so much. And as I mentioned, if there are any questions that you still have, you can follow up. If there's anyone we missed, we will follow up with you. But thank you all for being here. And Marianne and Dr. Draelos, thank you so much for this great presentation.
Thank you very much for your attention. We appreciate it.
Thank you.